Okay, so can you state your name and title?
I'm Dr. Fred Mather. I am the medical director of Sunnyside Home, the municipal home for the region of Waterloo.
How long have you been a physician?
I've been a physician for over 40 years now. I've worked in long term care my entire career. I was a family physician in an office practice, but for the last 6 years, I've been dedicated to long term care.
Excellent. So, how long have you been at the region of Waterloo at Sunnyside?
I've been at Sunnyside for 33 years and medical director for 25 years.
So, in your opinion, what makes being a physician rewarding?
I think it's the continuity of care. Being a family physician and a long term care physician, you get to know your patients well. Of course, in long term care, we don't refer to our residents as patients, but residents. This is where they reside, and it's an opportunity to care for them in their home. Working with a team of dedicated healthcare providers, the PSWs, the nurses, and other professionals such as the dietitians, the pharmacists, the physiotherapists, and social workers.
How has your profession changed over the past few years of the pandemic?
I think it's changed in many ways in that we, through the pandemic itself, we had to be very mindful of infection prevention and control. And we've learned lessons that we will carry on to protect our residents. We had to be careful during the first two waves of the pandemic, in particular when long-term care was disproportionately affected by the COVID virus, that we did more remote care at that time. Although I would say for the most part, the role of virtual care is much less now, because in long-term care, I think it's very important to be on site, to do your regular rounds, and have the meetings, for example, family meetings with our residents and their families or substitute decision makers, to have those meetings in person.
What's your favorite thing about Sunnyside?
As I've said already, I've been at Sunnyside for a while, and one thing I enjoy about Sunnyside Home is that there's a good consistency of staff here. That the people that I've worked with in management and in frontline care have worked here for a while. They enjoy where they're working, and they enjoy what they're doing. Another thing about Sunnyside as well is that it is more of a community than an institution. We have the long-term care home with 250 beds approximately, but there's also the community programs, the community Alzheimer program, the Seniors Day Away program, the Wellness Center, where people from the community come to us to be part of the Sunnyside activities. And we also have, as part of our campus, the supportive housing and seniors apartments, which makes this a very vibrant community to work.
Excellent. Is there anything else you'd like to add?
I find that there's an enthusiasm at Sunnyside that goes beyond the staff. For example, we have a large number of volunteers at Sunnyside who work and assist with the care of the residents. I'm often touched to see a volunteer who I knew as being a child of a parent who was a resident here at one time, or a spouse, and after their loved one has departed, they have chosen to carry on at Sunnyside as a volunteer. We have an active residents council that gives residents input into the activities, the food, and other concerns, and make them part of their care at Sunnyside.